Did you know that your sleep position can significantly impact your health and well-being? It's true. The way we sleep can directly affect our physical recovery, spinal alignment, and even our breathing. Now, you might be wondering, how can something as simple as our sleep position wield such power? Well, the answers lie in the intricate workings of our body as we rest. Sleeping isn't just about shutting off for a few hours, it's an essential period of rest and recovery for our bodies. From the alignment of our spine to the flow of blood through our veins, the position we sleep in can make a substantial difference. And it's not just about comfort. While a cozy position might send us off to dreamland faster, it doesn't necessarily mean it's the best for our health. In this video, we'll be diving deep into the world of sleep positions. We'll explore the pros and cons of sleeping on your side, back and stomach, and we'll also discuss how you can personalize your sleep position for optimal health benefits. So whether you're a side sleeper, a back sleeper, or a stomach sleeper, this video will reveal fascinating insights about the profound impact your sleeping position has on your well-being. Stay tuned as we unravel the mysteries of sleep positions and their profound effects on our health. First up, let's explore the realm of side sleeping, a popular choice among many. The side sleeper, a champion of comfort and a beacon of relief for many conditions that plague our nights. So, why side sleeping? Well, it's all about alignment, my friends. When you sleep on your side, you promote healthy spinal alignment, which is a fancy way of saying your back is less likely to hurt when you wake up. A good night's sleep is not just about rest, but also recovery, and that's something side sleeping does splendidly. But it doesn't stop at back pain. Side sleeping has a knack for reducing heartburn, a common nighttime nuisance. By positioning yourself on your side, you can keep that pesky acid in its rightful place, allowing you to sleep undisturbed. Now, we all know someone who sounds like a freight train at night, don't we? Yes, I'm talking about the snorers among us. Side sleeping can be their saving grace. By adjusting their position, they can reduce their snoring, making the night a lot quieter for everyone involved. Now, for the mothers to be out there, side sleeping comes highly recommended, particularly on the left side. This position encourages better blood flow and provides much-needed pressure relief. It's not just about comfort, but about providing the best for both mother and child. And for those with neck or back pain, a simple trick can make all the difference. By placing a pillow or a blanket between your knees when you sleep, you can further enhance the benefits of side sleeping. It's a small change that can bring about a big improvement in your sleep quality. While side sleeping has its perks, it's not all rosy. Let's delve into the downside of this sleep position. Despite its benefits, side sleeping may not be the best choice for everyone. Now, you might be wondering why. Well, it's essential to consider that this sleep position can cause some discomfort. One common issue is shoulder pain. When you lie on your side, especially for prolonged periods, your body weight can put pressure on your shoulder, leading to discomfort and sometimes even pain. And it doesn't stop there. Side sleeping can also be a culprit behind those pesky facial wrinkles. When we press our faces against the pillow night after night, it can cause the skin to crease and eventually lead to premature wrinkles. It's also worth noting that side sleepers may experience arm numbness. This happens when the position you're sleeping in puts pressure on the nerves in your arm, cutting off circulation. These are just a few of the potential drawbacks of side sleeping. It's crucial to weigh these factors when deciding on your sleep position. Remember, everyone is unique, and what works for some might not work for others. Now that we've shed some light on side sleeping, let's move on to another common sleep position, the back sleeper. Sleeping on your back is the second most popular sleep position. But what makes it so prevalent? You may wonder? Well, there's a host of benefits that come with being a back sleeper. First and foremost, back sleeping can be a boon for your spine. When you lie on your back, your spine is in a neutral position, which means it's neither arched excessively nor is it flattened. This neutral position allows for optimal spinal alignment, reducing the risk of developing back pain. So if you're looking for a way to give your back a break, you might want to consider becoming a back sleeper. Now, let's talk about nasal congestion. It's a nuisance, isn't it? But did you know that your sleep position can play a key role in relieving it? When you sleep on your back, with your head slightly elevated, gravity can work its magic, helping to drain your nasal passages more effectively. This can provide relief from nasal congestion and could potentially contribute to a more peaceful night's sleep. Another noteworthy benefit of back sleeping is its potential to prevent acid reflux. Acid reflux typically occurs when stomach acid makes its way up into the esophagus. This can cause a burning sensation in the chest known as heartburn, among other symptoms. However, sleeping on your back with your head elevated can help keep that pesky stomach acid in its place, thus preventing acid reflux. While back sleeping has its plentiful benefits, it's important to note that it's not a one-size-fits-all solution. For those who are prone to snoring or sleep apnea, back sleeping may exacerbate these conditions. So it's crucial to understand that while back sleeping has its benefits, it's not suitable for everyone, especially those prone to snoring or sleep apnea. Like side sleeping, back sleeping comes with its share of potential issues. While it can offer benefits such as spinal alignment and relief from nasal congestion, it's not without drawbacks. One key risk associated with back sleeping is the increased likelihood of snoring. This is because the position can cause the base of your tongue to collapse into the back of your throat, obstructing airflow. And where there's snoring, there's a potential for sleep apnea, a serious condition where breathing repeatedly stops and starts throughout the night. It's a silent thief, stealing away the quality of your sleep and leaving you tired and groggy in the morning. Moreover, for those who are expecting, back sleeping might not be the best choice. This position can put pressure on the major vein that transports blood back to the heart from your lower body. This can compromise blood flow to both mother and baby. So, while back sleeping can be a comfortable position for some, it's essential to be aware of these potential risks. Now let's explore a position that's generally advised against: stomach sleeping. Stomach sleeping, often frowned upon by sleep experts, is our next topic of discussion. The stomach sleeper, quite the enigma of the sleep world. This position, though favored by some for its comfort, is generally not the recommended way to catch your 40 winks. But why is that? Well, let's delve into the reasons. Firstly, stomach sleeping can lead to neck and back pain. When you lie on your stomach, you're essentially forcing your neck to one side for an extended period. This unnatural twist can strain the neck muscles, leading to discomfort or even chronic pain over time. Similarly, this position flattens the natural curve of the spine, which can result in lower back pain. Moreover, stomach sleeping can also contribute to wrinkles and sagging breasts. When you sleep on your stomach, your face is pressed against the pillow for hours at a time. This pressure can cause creases on your skin, which over time can deepen into more permanent wrinkles. As for sagging breasts, stomach sleeping applies pressure on the chest area, which over time can lead to sagging. But it's not all doom and gloom. Some stomach sleepers find that this position can help reduce snoring. However, the potential benefits are usually outweighed by the risks, making stomach sleeping a position best avoided if possible. Now, it's important to note that everyone is unique, and what works for one person may not work for another. So, if you're a dedicated stomach sleeper and you wake up feeling refreshed and pain-free, then perhaps this position isn't so bad for you. But if you're experiencing any of the aforementioned issues, it might be time to explore other sleeping positions. While stomach sleeping may be comfortable for some, the potential health risks make it a less desirable choice. So, with all these factors in mind, how do you choose the right sleep position for you? Now that's a question worth pondering over, isn't it? When we speak of sleep positions, it's essential to remember that there's no hard and fast rule. While there are general guidelines, the ideal sleep position can vary greatly from person to person. What might work wonders for one could be a nightmare for another. It's not just about spinal alignment or reducing snoring. It's about you as an individual, your comfort, your health conditions, and yes, even your preferred side of the bed. Let's picture this. You're a side sleeper, but you're waking up with shoulder pain. Perhaps a small adjustment is needed. A pillow or blanket between your knees might just do the trick to alleviate that discomfort. Or maybe, just maybe, it's time to experiment with back sleeping. And remember, it's not just about finding the perfect position, it's about being able to maintain it throughout the night. Ever found yourself starting off on your side and waking up on your stomach? That's your body telling you something. It's an invitation to explore, to adjust, and to find that sweet spot where comfort meets health benefits. Let's not forget those with specific health concerns. For instance, expectant mothers are often advised to sleep on their left side. Why, you ask? Well, it promotes better blood flow and provides pressure relief. But again, it's not a blanket rule. It's about what feels right for you and your baby. So as we navigate the world of sleep positions, let's remember this. It's personal. It's about trial and error, about listening to your body and understanding its needs. Your body is an incredible machine, and it often knows what it needs better than anyone else. Remember, there's no one-size-fits-all when it comes to sleep positions. Listen to your body. It knows what it needs. As we wrap up, it's clear that the way we sleep has far-reaching effects on our health. The position we choose to slumber in plays a pivotal role in our overall well-being, from spinal alignment to physical recovery. Whether you're a side sleeper, a back sleeper, or even a stomach sleeper, each position brings its own benefits and drawbacks, affecting various aspects of our health such as heartburn, snoring, back pain, and even facial wrinkles. But remember, there's no one-size-fits-all approach to sleep. It's essential to experiment with different positions, perhaps even incorporating a pillow or blanket for additional support. Find what works best for you, taking into account your own comfort and any health considerations. Sleep tight and remember, the right position can make a world of difference to your health. Good night and sweet dreams.